Chronic fatigue syndrome, or CFS, is a long-term complex illness that affects your brain and many different body systems. There's a wide range of different symptoms of chronic fatigue syndrome. For many of them, there are some effective and helpful natural health solutions. CFS is known as ME, which stands for the long name that you're seeing on the screen right now. This condition is often just referred to as ME-CFS or ME or CFS. The most common symptoms of chronic fatigue syndrome are extreme physical and mental tiredness that doesn't go away by resting or sleeping. This can make it difficult, if not impossible, to perform your ordinary duties and activities. Most people with ME, CFS, describe their fatigue as being completely overwhelming and oppressive. They say it's a different type of tiredness from what they've ever experienced before. ME and CFS, or chronic fatigue syndrome, can affect anyone, even children. It's far more common in women, and it usually develops between your mid-20s and your mid-40s. But it can and does affect people of any age depending upon the individual's circumstances. The symptoms of ME, CFS, are also similar to the symptoms of some of the other illnesses. So if in watching this video you come to believe you may have this condition, it's important to see your doctor or primary healthcare provider to get a proper diagnosis. Before going on, I want you to know that I fully understand that you're dealing with one of the most difficult sets of mental, physical, and emotional conditions in existence. I've created this video series to do my best to help people like you who are suffering from ME or CFS. After watching this video, you'll be better equipped to understand how your symptoms may fit into the official chronic fatigue syndrome symptoms as they're defined by the medical community. The symptoms of chronic fatigue syndrome can include extreme tiredness, impaired short-term memory or concentration, which significantly affects normal activities, sore throat, tender lymph nodes in the neck or arms, muscle pain, pain in multiple joints with no joint swelling or redness, headaches of a new type of severity, unrefreshing sleep or other sleep problems, flu-like symptoms, feeling dizzy or sick, and getting fast or irregular heartbeats known as heart palpitations. Other common symptoms include bloating, nausea, diarrhea, night sweats or chills, brain fogginess, dizziness, shortness of breath, chronic cough, visual disturbances, allergies or sensitivities to food, alcohol, chemicals, pain in your jaw, eyes or mouth. Most people find that overexercising may make their symptoms even worse. The severity and intensity of the symptoms of chronic fatigue syndrome can vary from day to day, or even within the same day, making it difficult to predict and cope with. With ME, CFS, even a normal cause of fatigue can be quite devastating. This is because the condition results in a severe lack of energy to begin with, and is often associated with various types of inflammation pain, making movements of the body, limbs and joints more difficult. Most cases of ME, CFS are mild or moderate. However, up to 1 in 4 people will experience more severe symptoms. If your symptoms are severe, a specialist should be involved in your treatment. Your chronic fatigue syndrome symptoms can be rated mild, moderate, or severe. They're considered mild if you can carry out everyday activities such as work, studies and housework, even though they may be more difficult to do. With mild symptoms, you may need to give up some hobbies or some of your social life, so that you can rest when you're not doing the work and taking care of your life's duties. Your chronic fatigue syndrome symptoms are considered moderate if you have problems moving around easily and carrying out normal daily activities. At this level, you might not be able to go to work or school, and you'll need to rest a lot. Further, you may have problems sleeping at night or have insomnia. When your symptoms are severe, you'll only be able to do very basic day-to-day tasks, and often this will be with great difficulty. This includes things like brushing your teeth, combing your hair, bathing, dressing yourself, and things like that. If the symptoms are severe enough, you may wind up housebound or even bedbound, and you may well need a wheelchair to get around. With severe symptoms, you'll have a lot of difficulty concentrating, and you may be really sensitive to noise and light. At this level, it can take a long time to recover after activities involving any extra effort, such as leaving the house or talking for long periods of time. Regardless what level your chronic fatigue syndrome symptoms are at, there can be times when your symptoms will get even worse too. These periods of time are generally known as setbacks or relapses. You have to ride them out and know that things will improve shortly. Having a number of natural health and alternative medicine type chronic fatigue treatments that you know work for you can really help you through such times. You'll be learning more about these alternative medicine approaches later in this video series. Be sure to subscribe to my channel, like this video, and click the bell icon so you won't miss any of the new helpful videos that I create for you. I've placed a link below this video to our core team of professional natural health practitioners too. These are trained and experienced experts that can help you with any health, physiological, psychological, and or emotional issues that you or a loved one might be dealing with. Many of them also have experience with helping people that are suffering from CFS. You can also work with them in a complementary way right along with your medical doctor, and they can do internet or phone consultations with you to help you sort everything out so you can find some relief.